Good morning. This is Dr. Verma here at Lifestyle Physicians. Today I'm really excited. We are going to introduce you to Dr. Cope, Alexandra Cope. She is a naturopath physician who trained in Oregon. She moved here to Richmond and she's joining Lifestyle Physicians. She specializes in fertility treatment, PCOS, and PMS. So before we start talking about PCOS, PMS, and fertility, Dr. Cope, why don't you tell us why you got into naturopathy and why did you specialize in PCOS fertility?
So I came into naturopathic medicine when I was looking at DO schools a year after looking into nutrition and everything else. And naturopathic medicine just really gets to the root cause, and we become specialists in both medicine. So I get to integrate in what I know from my training and use herbs and nutrition and lifestyle. And after about a year of being in primary care in Oregon, I saw so many families struggling to get pregnant, and a lot of the women had PCOS. So I turned my focus there, and my happiness comes in bringing families together with pregnancy.
Yeah, I think that's really awesome. As you all know, we already have Dr. Saad. She's a naturopath here, been with us for 4 years, and it'll be a great addition, and we'll have them working, and we hope to create an amazing integrative medicine center. I'm doing my fellowship in integrative medicine, so I hope we're going to make a great team and give you excellent services in the field of integrative medicine. So talking about PCOS, she loves talking about fertility, but I want to talk about PCOS because being in obesity medicine, I see almost every 1 in 3 or 1 in 2 younger females have signs, symptoms of PCOS, never diagnosed properly, and if they are diagnosed, then they're just on birth control pills. So that's like, painting a dying plant, you put a green spray on it, that doesn't turn the leaf green. Okay, you got to water the plant, see the nutrients. So tell us something about what is difference between a traditional medicine treating PCOS with birth control pills, and how do you approach it?
Well, when you look at PCOS, it really is a multiple hormone system or a multiple endocrine system. And so you have to take a look at what the brain hormones are doing along with the adrenal hormones and the ovarian hormones. And when you're just targeting PCOS with, say, and the pancreatic hormones, when you're just targeting PCOS, say, with birth control, all you're focusing on is the ovarian hormones. And what you want to look at is how is the blood sugar regulating and how is the hypothalamus and pituitary responding in with the brain hormones. And so basically what happens is when you're treating PCOS with herbs, then they have the ability to target the brain, the adrenals, and the ovaries. And so you start to see a symptom and sign reversal rather than just kind of painting the plant green like Dr. Verma said.
So like, can you describe a typical patient who comes to you and like who's been on birth control or who's been told to start on birth control? So how do you manage them? How do you approach them?
Yeah, often people with PCOS will go and get on birth control because they have irregular periods or acne, and there's not even actually a proper workup often by an OBGYN. It can be missed very easily because PCOS exists more on a spectrum. And so patients that come to me have experienced either longer cycles or else really not ovulating, lots of acne, or kind of a male pattern hair growth, and sometimes obesity and that type of blood sugar dysregulation where you get extra hangry or really tired after you eat. And so if somebody comes in that's on birth control, what I will do is often, because when you decide to get off of birth control, you can have a whole entire cascade of side effects, especially if you got on birth control in order to control your hormones. And so often what I'll do is work in conjunction with their OBGYN and say, okay, we're going to start giving you herbs and start really nourishing your system and control your blood sugar. And then you can get off your birth control in a month to 3 months. And then from there, it's about 2 months to 3 months of some pretty hard work with herbs.
Good. Okay. Yeah. So I don't know. I know majority of us in traditional medicine and the general public, we think PCOS is polycystic ovarian syndrome. That means ovaries have cysts. So just to let you know that when Steve Leventhal, who discovered PCOS, there was no ultrasound at that time. So PCOS is a dysfunction of the thyroid insulin resistance along with the ovary dysfunction. It's not just, my ovaries have cysts in the ovary. I mean, just treating patients for obesity has sometimes helped reverse the PCOS symptoms. We've had patients who've gotten pregnant just losing weight, and having reverse symptoms. So what is a typical time frame that you require for someone who's not been started on birth control for them to manage their PCOS and at least start having some sort of normal life? Because I have patients who've been struggling for so long. And the next question after that will be, what is your timeline for patients who are on birth control? How do you do that?
Yeah, and just to add on to some of the education of what PCOS is, you actually don't even have to have cysts on your ovaries to get diagnosed anymore. And there is a feedback loop from how your ovaries are communicating to your brain, that your brain pulsatile frequency, the frequency that's telling your ovaries to communicate to the rest of your system, then that gets disrupted, and that's actually what happens. And so if you're looking to correct PCOS symptoms, such as not ovulating or having your period a little bit off longer or else shorter than usual, then it can usually just take about 2 to 3 months. Hormones are usually on a 3-month lifestyle of changes. Hormones are usually on a 3-month cycle for your lifestyle changes. And then if you're getting off of birth control, it usually takes about 6 months to a year, depending on how long you've been on it and how your body responds to the birth control and how much you can detoxify off of the hormones that you're putting in your system.
Okay, yeah. So I think that's great news. That's a great description. So if you have questions, I know a lot of my patients do have PCOS and they're already excited. I've talked to a few of them who are ready to come on board. Dr. Cope is starting on March 2nd. You can already go on to our website and on the inquiry form select PCOS or PMS. I think next time we'll discuss about PMS, and then after that we can discuss fertility. She does great with fertility, so she's already known in that field. But I see so many patients with PCO and PMS that's my focus. I know when she starts, then definitely we're going to focus more on fertility. So yes, if you have any questions, concerns, you want to have a consult with her, you can find us on the webpage www.lifestylephysicians.com. You can comment on this link and we'll answer you. You can call us at 540-680-2426. And thank you for your time and welcome to the Lifestyle family.
Thank you.
Thank you.